Heart conditions. Myocardial infarction, heart attack. A myocardial infarction occurs when blood flow to a part of the heart is blocked, leading to damage or death of the heart muscle. Example, last year, I had a myocardial infarction, and since then, I've been closely monitoring my heart health and making lifestyle changes. Myo, relating to muscle, particularly the myocardium. Cardial, pertaining to the heart. Infarct, tissue necrosis due to inadequate blood supply. Ion, denotes a state or condition. Chest pain. Chest pain is discomfort or pain felt in the chest area. It can be caused by various conditions, including heart-related issues, such as angina or a heart attack. What does chest pain indicate, and when should it be considered a medical emergency? Chest pain can be caused by various factors, including heart-related issues like angina or a heart attack. It's crucial to seek immediate medical attention if chest pain is severe, prolonged, or accompanied by other symptoms like shortness of breath or pain radiating to the arm. Example, I've been having occasional chest pain. When should I be concerned and seek medical help? Palpitations. Palpitations refer to the awareness of one's own heartbeat, which may feel rapid, strong, or irregular. It's often described as a fluttering or pounding sensation in the chest. When should they be a concern? While occasional palpitations are common and often harmless, persistent or severe palpitations may indicate an underlying heart condition and should be evaluated by a healthcare professional. Example, lately, I've been experiencing palpitations, and it feels like my heart is racing. Should I be concerned about this? Palp, pertaining to feeling or touching. Palpitations, denotes a condition of. So, palpitations refers to the sensation of rapid, strong, or irregular heartbeats. Heart murmur. A heart murmur is an abnormal sound during a heartbeat, often indicating turbulence in blood flow through the heart valves. How is a heart murmur treated? Treatment depends on the underlying cause. Monitoring, medications, or, in severe cases, surgery may be recommended to address heart murmur concerns. Example, during my checkup, the doctor detected a heart murmur, so I'm scheduled for further tests to understand its cause. Murm, a low, continuous sound. Denoting a result or state. So, murmur is a soft, continuous sound, often linked to abnormal heart sounds during the heartbeat. Hypertension, high blood pressure. Hypertension is a condition where the force of blood against the artery walls is consistently too high, putting extra strain on the heart. What are the symptoms of hypertension? Hypertension often presents no symptoms. In severe cases, symptoms may include headaches, shortness of breath, nosebleeds, or vision changes. Example, managing my hypertension is crucial to prevent complications and reduce the strain on my heart. Hyper, denotes excess or high. Tension, referring to pressure. So, hypertension means high or excess pressure, commonly used to describe high blood pressure. Congestive heart failure, CHF. Congestive heart failure occurs when the heart is unable to pump blood effectively, leading to a buildup of fluid in the lungs and other tissues. Symptoms include shortness of breath, fatigue, and fluid retention. What are its common symptoms? Common symptoms include shortness of breath, fatigue, fluid retention, edema, and a persistent cough. It requires medical evaluation and management. Example, I've been feeling unusually fatigued and noticed some swelling in my ankles. Could these be signs of congestive heart failure? Arrhythmia. Irregular heartbeat. An irregular heartbeat, or arrhythmia, is a condition where the heart rhythm deviates from the normal pattern. It can include a fast, slow, or irregular heartbeat. How is an irregular heartbeat diagnosed and treated? Treatment varies depending on the type and severity of the arrhythmia and may include medications, or procedures to restore a normal heart rhythm. Example, my doctor mentioned that I have an irregular heartbeat. What are the treatment options for this condition? A, denoting absence or lack. Rhythmia, referring to rhythm. So, arrhythmia means the absence of a normal, regular heart rhythm, indicating an abnormal heartbeat. Bradycardia. Bradycardia is a slower than normal heart rate, typically below 60 beats per minute, which can result in dizziness, fatigue, or fainting. Example, my recent health checkup revealed bradycardia, a slower heart rate than usual. My doctor is investigating the underlying cause and potential interventions. Tachycardia. Tachycardia refers to an abnormally fast heart rate, often exceeding the normal resting rate, which can lead to various symptoms and complications. Example, I've been experiencing episodes of rapid heartbeat, and my cardiologist diagnosed it as tachycardia. We're exploring treatment options to manage it. Supraventricular tachycardia, SVT. SVT is a type of tachycardia that originates above the heart's ventricles, causing rapid and irregular heartbeats. Example, I've been diagnosed with supraventricular tachycardia, and my cardiologist is discussing treatment options to address the rapid heart rate episodes. Atrial fibrillation, AFib. Atrial fibrillation is an irregular and rapid heart rate that can increase the risk of stroke and heart failure. Example, after experiencing palpitations, I was diagnosed with atrial fibrillation. Now, I'm on medication to control my heart rate and reduce stroke risk. Ventricular fibrillation. Ventricular fibrillation is a life-threatening heart rhythm disorder where the heart's lower chambers quiver instead of pumping blood, leading to cardiac arrest. Example, my friend experienced ventricular fibrillation, a serious condition requiring immediate medical attention and intervention to restore normal heart rhythm. Long QT syndrome. Long QT syndrome is a rare genetic condition affecting the heart's electrical system, leading to a prolonged QT interval on an electrocardiogram, ECG, which can cause irregular heartbeats. Example, my doctor mentioned that my ECG showed a prolonged QT interval, suggesting long QT syndrome, and we're discussing ways to manage this condition. Brugada syndrome. Brugada syndrome is a rare genetic disorder that can cause irregular heartbeats and increase the risk of sudden cardiac arrest. Example, my family has a history of Brugada syndrome, so I underwent genetic testing to determine my risk and take necessary precautions. Coronary artery disease, CAD. Coronary artery disease involves the narrowing or blockage of coronary arteries, limiting blood flow to the heart muscle and increasing the risk of heart attacks. Example, my doctor mentioned that I have coronary artery disease, which means my heart may not be getting enough blood due to narrowed arteries. Angina. Angina is chest pain or discomfort that occurs when the heart muscle doesn't receive enough oxygen-rich blood, often due to narrowed coronary arteries. Example, I've been experiencing angina, a tightness in my chest, especially during physical activity, which my doctor says is related to reduced blood flow to the heart. Atherosclerosis. Atherosclerosis is the buildup of fatty deposits, plaque, in the arteries, reducing blood flow and increasing the risk of heart-related issues. Example, the chest pain I've been having is due to atherosclerosis, where the arteries are narrowed by plaque buildup. Peripheral artery disease, PAD. Peripheral artery disease involves the narrowing of arteries outside the heart, usually in the legs, leading to reduced blood flow. Example, my doctor diagnosed me with peripheral artery disease, explaining that the pain in my legs is due to poor blood circulation. Valvular heart disease. Valvular heart disease involves damage or dysfunction of the heart valves, affecting blood flow within the heart. Example, I've been diagnosed with valvular heart disease, and my cardiologist is discussing treatment options to repair or replace the damaged valve. Mitral valve prolapse, MVP. Mitral valve prolapse occurs when the valve between the heart's upper and lower chambers doesn't close properly, allowing backward flow of blood. Example, My doctor informed me about mitral valve prolapse, explaining that it's a common condition and often doesn't require treatment unless symptoms are severe. Endocarditis. Endocarditis is the inflammation of the inner lining of the heart chambers and valves, usually caused by bacterial infection. Example: I was recently diagnosed with endocarditis after experiencing persistent fatigue and fever. Treatment involves antibiotics to clear the infection. Pericarditis. Pericarditis is the inflammation of the pericardium, the sac surrounding the heart, causing chest pain and discomfort. Example: I've been dealing with chest pain, and the diagnosis is pericarditis. My doctor prescribed anti-inflammatory medication to alleviate symptoms. Cardiomyopathy. Cardiomyopathy is a condition where the heart muscle becomes weakened or enlarged, affecting its ability to pump blood. Example: after being diagnosed with cardiomyopathy, I've been advised to follow a treatment plan to improve my heart function. Ischemic cardiomyopathy. Ischemic cardiomyopathy occurs when reduced blood flow to the heart muscle, often due to coronary artery disease, leads to heart muscle damage and weakness. Example: due to reduced blood flow to my heart, I developed ischemic cardiomyopathy. My doctor is considering interventions to improve blood circulation. Dilated cardiomyopathy. Dilated cardiomyopathy is a condition where the heart chambers become enlarged, weakening the heart muscle and impairing its ability to pump blood. Example: my echocardiogram showed signs of dilated cardiomyopathy, and my treatment plan involves medications to improve heart function. Hypertrophic cardiomyopathy, HCM. Hypertrophic cardiomyopathy is a genetic condition where the heart muscle thickens, making it harder for the heart to pump blood. Example: due to hypertrophic cardiomyopathy, my heart muscle is thicker than normal, and my treatment plan includes medications to manage symptoms. Wolff-Parkinson-White syndrome, WPW. WPW syndrome is a heart condition where an extra electrical pathway exists between the heart's upper and lower chambers, causing rapid heartbeats. WPW syndrome is a heart condition that is present at birth. Example: my electrocardiogram showed signs of Wolff-Parkinson-White syndrome, and my cardiologist is discussing potential treatment options. Patent ductus arteriosus, PDA. Patent ductus arteriosus is a congenital heart defect where a blood vessel called the ductus arteriosus fails to close after birth, affecting blood circulation. Example: my newborn has patent ductus arteriosus, and the pediatric cardiologist is monitoring the condition to decide on the appropriate treatment. Tetralogy of Fallot. Tetralogy of Fallot is a congenital heart defect involving 4 abnormalities, affecting blood flow and oxygen levels in the heart. Example: our newborn was diagnosed with tetralogy of Fallot, and the pediatric cardiologist is discussing surgical options to correct the heart defects. Raynaud's disease. Raynaud's disease is a condition causing reduced blood flow to certain areas of the body, usually the fingers and toes, in response to stress or cold temperatures. Example: I've been diagnosed with Raynaud's disease, and my fingertips turn white and numb in the cold. My doctor recommended lifestyle changes to manage symptoms. Aortic aneurysm. An aortic aneurysm is a bulge or weakening in the wall of the aorta, the body's largest artery, which can be life-threatening if it ruptures. Example: my recent imaging showed an aortic aneurysm, and my doctor is monitoring its size to determine if surgical intervention is necessary. Treasure your heart.